Hi, this is Dan Hombut with the LTME team, providing an update on a report that we prepared for the Board of Trustees regarding how we're going to maintain our campus during the pandemic. So I just want to give you a brief summary. There's three essential components to this. First, how are we going to maintain our campus during closure, so well in advance of us opening it up? And these are more things not directly related to COVID, but they are related to safety and well-being once we do open. So making sure the air conditioning system is properly set, making sure the filters are changed, making sure the drains are functional. From a plumbing perspective, making sure that the faucets and toilets are operated so that there's fresh water, making sure that the traps are functional. So in the bathrooms, for example, or near the water heaters, when there's a leak, let's make sure that the traps are functional. Performing periodic inspections to see if we have mold or mildew that are problematic that we might have to get cleaned and then solve the problem that caused it. And finally, we do have a few occupied spaces, primarily the office, and making sure that the common spaces in there are cleaned on a regular basis. Prior to opening, we need to do a number of things. And again, this first one, a deep cleaning, isn't necessarily associated with COVID, but the spaces in our campus haven't been occupied for a long time. So we really want to make sure they're cleaned well. We also want to make sure that we purchase the supplies that will be necessary to clean it as we do occupy the spaces and also disinfect. And many of those materials come as bulk, so we've got to break them down into spray bottles and other containers that everybody can use and use safely. Finally, we want to reduce community sharing, so we're considering putting the hymnals away. Do we need order of services? Should we have pamphlets? Those are things that have to be considered. And finally, developing signage so that we explain to everybody where they should and should not be and remind them that they should be taking care and cleaning and safe distancing, etc. Developing an accessibility plan. So how do we enter the sanctuary? How do we leave the sanctuary or the other spaces just to minimize or reduce contact with others as we're passing through? And finally, the training of staff and volunteers. Now, when it comes to the campus being open, we need to develop a plan of how we're going to clean our spaces. So for example, if we come in and use it on a Sunday and everybody's in Gore Hall, they're in the Enrichment Center, for example, of course, the sanctuary, Victor is likely going to do the large scale cleaning after a use like that. But what about small groups that use a classroom for a covenant group? Or what about the choir going into a part of the sanctuary? We've got to figure out how we're going to manage those spaces to clean them, because we don't want a Victor to come in and clean the entire campus for one small group having been there. And assigning the responsibilities. So is it Victor the custodian? Do we need to hire a cleaning service? Are we going to rely on volunteers for smaller tasks? And then really implementing how we are in the space to protect ourselves. So physical distancing, do we need to tape off some of the pews? Promoting the use of masks or requiring the use of masks, but having some available for those that forget. Using sanitizer, washing, cleaning, all those kind of things that we've heard about for months. And finally, what are the special plans for social hour, for classrooms, for the nursery? So we have a big ask for you. We would like to have 5 small group leaders meet with an LTME representative one time to help us figure out how volunteers can participate in the cleaning of our campus when we have small group use. We are proposing that that be a one-time Zoom meeting in the next week or so. So if you're interested, and we really would appreciate at least 5 people helping us out, you can contact me at ltm@orlandouu.org. Thank you so much.